My name is Nicole, and I am a clinical pharmacist at the Miriam Hospital and a medication therapy management pharmacist, or MTM pharmacist, here at the Cardiac Pulmonary Rehab. Today we're going to discuss the different types of inhaler regimens and how to get optimal maintenance of your lung disease with them. There are many types of inhalers, and your doctor tends to choose maintenance regimens based on your disease state, what medications will best benefit your lungs, and what is easiest for you to use. Unfortunately, too, sometimes our insurance plans dictate which inhalers are covered, brand versus generic, but know that pharmacists and doctors can try to work together with the insurance company to have access to a specific inhaler that you know works best for you. So keep that in mind. The medications inside our inhalers can be different, and the devices themselves are different as well. This means that specific techniques are required to get a full dose of your inhaler puff. The type of inhale that you do is even important, and how you hold the inhaler. So we're going to go over that. But in general, why are inhalers important? They help to improve airway flow and decrease obstruction in your lungs, and that obstruction can be caused by different things: mucus, inflammation, due to our triggers. If you have allergies, if you have COPD, asthma, there's different things that cause that obstruction. The inhalers specifically are designed to decrease the secretions or mucus that's going on in your lungs and decrease inflammation as well. So there's generally two types of inhalers. We have your rescue inhaler and we have your maintenance inhaler. Rescue inhalers are usually as needed for shortness of breath, and you notice those effects immediately, usually. So if you think about rescue inhaler, if you're calling rescue, you call 911, they're gonna come fast. That medication inside the rescue inhaler usually works nice and fast. Maintenance inhalers are for everyday therapy. It works in the background to help maintain open airways. Most people take their maintenance inhaler and they say, I don't feel any difference, must not be working, I'm not gonna take it. Well, actually, when most people take their maintenance inhalers, they don't feel different right away. This is because, just like other maintenance medications, like for diabetes or for high blood pressure, it takes a few weeks or months to build up in your lungs and provide the full treatment. So it's important to take it every day, and the albuterol or rescue inhaler as needed, or as a preventative measure. So to go into our rescue inhaler more, those are usually considered short-acting beta agonists, which is pretty much just a fancy term for a medication that opens the airways really fast by relaxing the muscles in our lungs. It's used to relieve that sudden shortness of breath or wheezing that you're experiencing due to certain triggers. Usually taken as needed, but your lungs work differently than other people's. You have specific lung diseases that may mean that you can benefit from your rescue inhalers in different ways. It means that you do not necessarily have to use the rescue inhaler only in emergency situations. Also know albuterol inhalers, they have usually 250 puffs in them. So you don't have to salvage it and hold it just for emergencies. For lungs like yours, we want to make sure that we can prevent that sudden shortness of breath from happening. So what I want to empower you to do is don't be afraid to use it preventatively when it comes to your triggers. So if you know, oh man, my apartment, I have like 14 stairs I need to get up, or whenever I vacuum, or whenever I need to bring my groceries in, I know that is going to cause me to have really bad short of breath, and I'm going to have to sit on my bed and catch my breath for like 20 minutes afterwards. If you know those things are going to cause that, what I recommend is maybe 10-15 minutes before you're doing the activity or exercise that may cause that short of breath, don't be afraid to take your albuterol inhaler, regardless of how you feel in that moment. Then if you have that medication in your system, hopefully after you do your triggering activity, you won't have to be chasing that shortness of breath afterwards. So I definitely recommend, before you do a triggering activity, 10 to 15 minutes, don't be afraid to use your albuterol inhaler. Also, you may also find that it's helpful to use before taking the maintenance inhaler. What it'll do is it'll open your airways, and then when you take your dose of your maintenance inhaler, it's going to ensure all of it gets right down into your lungs. So I can recommend that, a couple minutes before you take your maintenance inhaler, so that's like your Advair, your Symbicort, your Trilogy Ellipta, you can take a couple puffs of your albuterol inhaler before that, and it just kind of makes sure more of that dose gets into your lungs. That's also important if you know you're having a bad day with your breathing. If it's hot, humid, dry, you have the pollen's out, we want to make sure that even when we have those different things going on with the weather that's causing you to have shortness of breath, that you're still getting full coverage from your inhalers. So that is our rescue inhaler, and that's the fast acting. We're going to kind of touch base on what is inside your maintenance inhalers. So there's so many different combination products of maintenance inhalers. What that means is certain medications come in different devices. The Advair inhaler might only have 2 ingredients, while your Trilogy inhaler may have 3 ingredients. So some people find that they're on 3 or 4 inhalers and they're like, what are all these for? It's because the doctors want to focus on optimizing the maintenance of your lungs with 3 different types of medications. There's a long-acting beta agonist, long-acting muscarinic antagonist, and a corticosteroid. The first 2 fancy words are pretty much medications that just promote that relaxation of all of the muscles in your lungs in different ways. So if you have one of the medications, the LAMA, they call it, and the other medication called the LABA, both working in your lungs in different ways to open your airways, it's going to provide you a little bit more coverage. And then some of the inhalers, or some doctors will have you be on a separate inhaler that is a inhaled corticosteroid. So together we have short-acting medications, we have long-acting medications, and we have medications that are decreasing your inflammation in your lungs. The long-acting beta agonists and the long-acting muscarinic antagonists, those fancy medications work the same way as the albuterol type of medication, but it's providing a long-term relaxation. It's keeping everything under control in your muscles. The corticosteroid, just like we take steroids orally for inflammation, if we got a poison ivy or something like that, corticosteroids can be in a aerosolized powder, and what that will help with is any inflammation that's going on in your lungs. It's pretty much the steroid can go right to the area of your lungs that you're having issues with. If you have an inhaler with a corticosteroid in it, it's super important to always rinse and spit after every use. The reason why is steroids, especially inhaled steroid, can actually cause a gross, nasty, white yeast infection in your mouth if you don't rinse and spit. So a foolproof way, if you don't even know, hey, does this inhaler have a steroid in it or not, rinse and spit after you use all of your inhalers, if that makes it easier. But specifically, if you have an inhaler that has the corticosteroid for the inflammation, that is what may cause that thrush reaction. Thrush is what is that yeast infection. They kind of use that word sometimes. So, maintenance inhalers and rescue inhalers, the devices are completely different sometimes, depending on what brand it is, what medication it is, and it's important to understand that the devices require different type of breathing techniques. So if you think about your rescue inhaler, or if you use Symbicort, that Symbicort inhaler, those are considered metered dose inhalers. This is the L-shaped one that I'm talking about, where there's a canister you press down in order to release the medication. So essentially, think about your albuterol inhaler. That device is a metered dose inhaler. When you press that button down, or the canister down, all of the medication goes into the mouthpiece, and it sits there, and it pretty much is waiting there for you to inhale the medication. So what that means is you do not need to do a quick, fast-paced breath in order to get the medication dose. It's actually better if for those types of inhalers and to get full benefit from your rescue inhaler if you use a long, controlled breath. If you ever are taking your rescue inhaler and you notice it's making a squeaky noise, that is the device telling you you're breathing way too fast. You should never hear that squeaky noise, and you want to do a long, controlled breath for the metered dose inhalers. So that's your albuterol or your Symbicort. A lot of the maintenance inhalers with all those different ingredients, they tend to be different. They usually are those, circular or rectangular devices where you hold it like a hamburger when you use it, right? So those are called dry powder inhalers. And pretty much exactly as the name, there's a dry powder inside of it that has all the medications. Now, when you use those inhalers, usually there's like a little lever or something that you need to move to click the dose in, right? So different than your meter dose inhaler, you're pressing the canister down, it's releasing the medication and it's waiting there for you, right? Ready to go. For the dry powder inhaler, when you move the lever or press the button and you hear that click noise, that just means it's loaded. That doesn't necessarily mean that the medication is, easy to suck out. So with dry powder inhalers, you actually want to think about doing a short, quick breath. Because that device, the dry powder, you actually have to physically suck the medication out of it. Whereas the other inhalers, you can release it and then you can inhale it with a long controlled breath. So metered dose inhalers, long controlled breath, dry powder inhalers, and that can be your Advair Discus, your Trelegy Ellipta, Incruz Ellipta, those fancy ones. Those need a short, quick breath in order to get all of the dose into your lungs. Over time, I have made that recommendation to some of my patients, and they say, wow, I do kind of notice that my maintenance inhaler is working better. So something to think about. Now, inhalers are important for daily use, and it's important to keep them with you, especially your rescue inhaler. Now, if you're taking it around with you places, once in a while you may need to clean it. So cleaning the inhalers is important too, because as we know, if you have lung disease, you're at higher risk for getting an upper respiratory tract infection if a bacteria or virus is introduced to your lungs. So we want to make sure that we clean our inhalers once a week would be great. So when it comes to your metered dose inhaler or your rescue inhaler, you want to remove the canister and the mouthpiece separate. You usually run some warm water through the plastic mouthpiece, and then you just kind of shake the water off and let it to air dry before you put that little medication canister back in it. You don't need to use like a Clorox wipe, you don't need to use soap, you don't have to use any of that, just warm water and let it air dry. The dry powder inhalers, you just leave it as is, and it's good to just wipe it down with a dry cloth. You don't want to use water or soap or anything like that, because we don't want any part of that inhaler where the powder needs to access to get clogged if it gets wet in any way. So dry powder inhaler, keep it dry. Meter dose inhaler, separate the parts, put it in warm water, let it air dry. Now, we talked a lot about the inhalers, but the two most important things I tell everybody to manage their lung disease is cutting down on smoking or quitting completely, if possible, and appropriately using your inhalers. Some of you are way ahead of me and already have quit smoking, but we want to make sure that you have these, fancy inhaler regimens. We want to make sure they're benefiting you. There are some more complicated forms of lung disease, however, that require a different approach to treatment than just inhalers. They are called pulmonary hypertension and pulmonary fibrosis, which some of you may live with. Pulmonary hypertension, pretty much if you break down the words, pulmonary means lungs, hypertension means high blood pressure. So essentially, pulmonary hypertension is high blood pressure in the arteries of your lungs, and it affects the right side of the heart as well. This is usually caused by a complicated, complex health condition that can be caused by your genetics or advanced stage diseases such as long-term coronary artery disease, high blood pressure, liver disease or cirrhosis, chronic lung diseases, and if someone also has a history of ever having a blood clot in their lung. So we want to make sure that if possible, we can prevent pulmonary hypertension or pulmonary fibrosis from happening if it's not of genetics, right? So we have things we can and cannot control in our lives. Our family, where we come from, our genetics, we can't control that, unfortunately. But we can control things we do in our lives, like if we cut down on smoking, if we take our inhalers, if we're proactive about our lung health, right? So there are ways to prevent. Pulmonary hypertension usually presents with shortness of breath, but also some dizziness and chest pressure. This condition can worsen over time, but there are medications and different therapies that are used to help lessen symptoms and improve quality of life over time. So the initial treatment is kind of an approach with different things. We're thinking about our blood, we're thinking about the fluid in our body, thinking about how our lungs are doing with oxygen. So one of the things that your doctor might put you on is some form of blood thinner, such as warfarin. We want to thin the blood to make sure that we're preventing any clots, especially in your lungs. Some doctors may also add a water pill or a diuretic. Those allow you to remove excess fluid from your body that can accumulate around your heart. Usually that happens, you take a water pill, it causes you to pee like a racehorse. I'm sure some of you have experienced that before. The most important therapy, however, is oxygen. Oxygen therapy is proven best to reduce patient mortality. So oxygen therapy is one thing. The other most important approach is exercise, which is exactly what you're doing here at Pulmonary Rehab. This can improve the oxygen use and make sure that it's going where it needs to go, strengthens your lungs, and improves your quality of life. So we're happy you're here. The other disease state I mentioned is pulmonary fibrosis. So if you think of the words in this case, pulmonary means lung, fibrosis means scar tissue, scarring. And that's exactly what it is. Scar tissue is developing in your lungs, on your lungs, especially on the alveoli. And if we know what alveoli are, they're the tiny little air pockets and sacs that are all across your lungs. And those are responsible for all of the oxygen going where it needs to go in your lungs, to your blood, to the whole rest of your body. So if those are scarred, they're stiff and they don't want to work. They don't want to do anything if they're stiff because of the scar tissue. If those alveoli are stiff, then oxygen's not going to be able to move freely across those air sacs, across your lungs, to your blood and to your body. So pulmonary fibrosis makes it more difficult to get oxygen where it needs to go. There is no cure for this, but the focus is slowing disease progression and improving quality of life. So the mainstay, similar to pulmonary hypertension, is oxygen. Oxygen therapy is very important to maintain that normal activity in your whole body. This also can help delay or prevent pulmonary hypertension. So some people who have fibrosis going on may eventually fall into the pulmonary hypertension category as well. So that's why we want to be as proactive as possible. Similar, again, is pulmonary rehab, super important. Anything that we can do to figure out how to teach our lungs to reduce shortness of breath and be stronger is important. So oxygen and pulmonary rehab are kind of the mainstays, but there are some medications that are proven to slow the progression of disease. So these medications are kind of fancy, and all of them pretty much work by preventing the body from forming that scar tissue. It works on the immune system a little bit, it works on your blood a little bit, and it's just trying to keep those fibroblasts or scar cells from forming. So some of those medications include nintedanib, probably didn't say that right, nintedanib. I'm a pharmacist, and sometimes those are hard to pronounce. And the other more common is pirfenidone. So those are the two medications that are proven to kind of slow that scar formation. Some people, however, for more advanced disease may trial sildenafil. So sildenafil is the same as Viagra, but it actually has an FDA-approved labeling to treat pulmonary hypertension that's associated with the scar tissue. So that's something that your doctor may consider if necessary. So in advanced stage, some patients may require a lung transplant, but we're hoping that we can be proactive and keep that progression from happening. Many patients, with pulmonary fibrosis also, weirdly enough, experience acid reflux. So, if you have lung disease already, and you start to have more acid reflux than usual, definitely something to kind of be like, oh, should I ask my doctor and maybe get some peace of mind on that. So people who have this acid reflux or GERD with their pulmonary fibrosis, it's important to make sure it's treated. It's not something we just suffer through. Because it's actually shown that if you treat the acid reflux with, omeprazole or ranitidine, Zantac, it actually improves pulmonary fibrosis outcomes. So it's very important to have that conversation with your doctor if need be. So I want you to know that as an MTM pharmacist, I am a resource for you whenever you may need it, or an advocate if you need someone to help ask the difficult questions about your health and wellness. So at any time during or after your program, don't be afraid to use me as a resource. We can sit down and chat about anything you want, whether it's medication related or not. And if you are interested in sitting down with me, we can set an appointment aside. It could be 30 minutes to an hour, and we can, spend some time together. If you're interested in that, reach out to your case manager and we can set that up. Thank you for your time.